Hello everyone, this is Julie and I will be discussing the arterial arcs of the foot, the dorsal and the plantar, and I will be using pictures from the Netter's Atlas to be explaining on them. And I hope you find it beneficial. I'll be starting with the dorsal surface of the foot. First thing we have to understand is that the dorsal, from the anterior compartment of the leg, we have the anterior tibial artery that is passing deep to the extensor retinaculum. Once the anterior tibial artery passes under the retinaculum, it changes its name to dorsalis pedis artery. So it's the same thing, but different locations, it's changed its name. Once the dorsal pedis artery is, like when we look at it from the dorsal surface, we can feel its pulse between the first and the second metatarsal. And also, the dorsalis pedis artery does three things. First of all, it gives the arcuate artery over here, which is not very clear because there are some structures covering it. We're going to see it in the next picture. It will be more clear. Also, it will give the deep plantar artery. And from its name, since we're looking at the dorsal surface and we're saying it's deep plantar artery, it means that this artery will leave the dorsal surface. It will deepen to go to the sole of the foot. And it will also participate in an anastomosis, which we'll be mentioning in a bit. The same dorsalis pedis artery will also continue to the first metatarsal bone. So the artery itself will continue to supply blood to the first metatarsal. It will give a deep plantar artery, which will deepen into the sole of the foot. And also it will give the arcuate artery. Now, if we remove some structures, this is more clear now. We can see the dorsalis pedis artery passing all the way to the first metatarsal. It also gives this deep plantar artery that is deepening into the sole, and it gives the arcuate artery. The arcuate artery will give branches to the lateral three metatarsals, so it can supply them with the blood. Now, something to mention about the three dorsal metatarsal arteries is that they themselves will also anastomose with the perforating branches, which we will look into in a bit when we discuss the deep plantar arch. Now, if we look at the sole of the foot, the sole of the foot, we have 4 layers. I'm going to look at the second layer of the muscles of the sole of the foot. Now I can visualize, I can see the posterior tibial artery. So in the dorsal surface, we said we had anterior tibial. Here we're going to have posterior tibial artery, and this will terminate by giving 2 branches. So this is the termination actually of the posterior tibial artery. And the 2 branches that it will give are medial. So one of them is the medial plantar artery, and the other one is the lateral plantar artery. Now, the lateral plantar artery is actually the one that will be forming our plantar arterial arc. So the lateral plantar artery is what starts the plantar arterial arc, and this arc is completed by the deep plantar artery, which we mentioned when we were looking at the dorsalis pedis. So we mentioned that the dorsalis pedis will give an artery, a branch that will deepen into the sole. This branch is actually what will anastomose with the lateral plantar artery to complete the arc. Now, going back to our sole of the foot, this is the 3rd layer now. So we remove the 2nd layer muscles, and we're currently looking at the 3rd layer muscles. This is our adductor hallucis. So the lateral plantar artery will pass here. It will deepen under the adductor hallucis so that the actual plantar arterial arc is actually between the 3rd and the 4th layers of the sole of the foot. So here we were looking at the 3rd one. The lateral plantar artery deepened under the adductor hallucis, so it can be viewed in front of the 4th layer muscles, which are here in our case the plantar and dorsal anterossi muscles. So we have the plantar arc formed. This is over here the deep plantar artery, where it will anastomose with the lateral basically the plantar arterial arc, which is formed by the lateral plantar artery. Now, some things to note down about this arterial arc is that it is giving out branches. So what are those branches? We have the perforating arteries. This is 1, 2, and 3. So they are basically supplying the 2nd, 3rd, and 4th intermetatarsal spaces, and they anastomose with the dorsal metatarsal arteries of the arcuate artery, which was from the dorsalis pedis, which we already mentioned in the beginning of the video. We also have branches that supply the metatarsals. It is supplying the lateral side of the little toe, and also they form common plantar digits, common plantar digital arteries. As we can see, those common plantar digital arteries will divide so they can supply the sides of the toes, as you can see. And also, the medial side of the big toe is also supplied by this the plantar arch.